Let me see how far I can go. You can see the screen, right?
Yes.
Yes, from my side.
Yeah, so we're going to look at health, what is really health, what different people understand by what are the explanations for health. Basically, those are the models of health. So let's start. So when you talk about health, um, we are basically referring to a multi-dimensional state of well-being encompassing moral, mental, and physical aspects. The WHO defines health as a state of complete physical, mental, and social well-being, and not merely the absence of disease. That's the definition by WHO. Okay. In other aspects, you can say that if a person can socially function, occupationally function, and they can perform whatever function of daily living, then they are really healthy. But we can also look at health as a good. This is uh, an economist's eye. An economist can look at health as a good that you can really invest in and reap good results, or and reap the good outcomes. Okay, so we can say that uh, if the government invests in health, it's basically making a very good investment because we will have good productivity, we have a booming economy and things like that. And that is why we did look at health as a good. But remember, a good can produce can give you something good. I mean, a good produces what you call utility. There is that benefit associated by using a good. So health as a good can generate positive externalities. You have issues to do with reduced transmission of diseases, issues to do with increased social capital, and then also opportunities for economic growth. So we use what you call models of health to understand what health is really. And when we understand what health is really, then that means that we can really design the appropriate interventions or strategies to improve population health. The first one is the biomedical model of health, which emphasizes that, you see, when you come to the hospital, we check you for malaria. When we see the parasites, we give you the treatment, and then you become better. So that is the biomedical uh, model of disease or of health. Okay, it looks at interventions, medical interventions, which basically include the workups, the examination, the laboratory workup, and then the treatment that you're giving, whether it is pharmacological or it is surgical. That is the biomedical one. The biopsychosocial model looks at health in the three dimensions: the biological component, the physiological which is basically the physiological component, and then the social component, and then the psychological component. So it integrates all these elements. Just as noted from the definition of WHO, which has the social and mental well-being, okay, and the physical health. So this biopsychosocial model relates more to the WHO definition of health. So when you talk about the biological factors, we basically look at the physiological processes and the genetic makeup issues. Of course, genetics can predispose to certain conditions, and then also even when you look at infectious agents, there are biological factors involved, where you have some people being susceptible, where also we have some people being immune. And then when you look at the psychological component, we basically look at the emotional and mental factors and their influence on health. I highlights the importance of one's thoughts, emotions, and beliefs regarding their health outcomes. So, psychological well-being is very important in one's perception of the disease severity and even the extent of healing and how they can cope up with even a disease. Okay, and then the social factors relate to the social and cultural context under which a given disease can be interpreted. How a given disease is interpreted socially or in the social dimension, it relates to whether the person will actually go and get treatment or not, and whether they will actually adhere to the treatment. So social factors influence health-seeking behavior, influence adherence to medications, but also provide support to ensuring that the person who is actually sick can actually cope up with the disease. So the biopsychosocial model emphasizes the fact that health should be looked at in a holistic way. So it is health cannot be looked at in isolation, where you look at the one camp and say this person has malaria and that's all. No, other factors all have to really be considered. And therefore, when you're actually providing care, you should actually include the patient in their own care. This is the approach which we call the patient-centered care. Because if you involve them in their own care, you're covering all the other aspects, the psychological and social aspects, such that they can really make choices on what care is appropriate for them. And then we move to what you call the interdisciplinary collaboration, which basically emphasizes that people need to work together for better health outcomes of an individual. Prevention and intervention are also very important. It means that the emphasis is actually placed on prevention. This is very, very, very key. Looking at the social and psychological factors and even the biological factors that can bring about disease. So health prevention and health promotion actually, become actually very, very important. And this model also underscores the fact that health is not one dimensional. It is a complex issue that is actually influenced by a number of factors. That's very important to actually take note of them. So in our previous definition, we noted that well-being in terms of physical, mental, social, and emotional. These are very important dimensions of health, and as actually underscored by the previous model. The ecological model of health actually emphasizes that, you see, the factors that influence health can happen at different levels. The person or the individual can have factors that predispose them to certain conditions. And then the next level, which are the interpersonal factors, okay? This is where you see the immediate family, their relation, even their friends and things like that. And these actually play an important role. And then the community and then the society. So the ecological model of health emphasizes that health within a given context can actually be influenced by a number of factors which can occur at individual, interpersonal, community, and societal level. And then we have the life course perspective in public health. This is to say that, you see, by the time someone gets a particular disease at a given age, that outcome does not happen from the blue, but it happens because of different factors and experiences that the person has been getting throughout their life. That means that even from conception up to old age, the factors that one was exposed to at conception up to early age play a very important role in shaping their health outcomes. Okay, and that is why it is very, very important to take care of pregnant women. Okay, that is why maternal health becomes very important, because it is at that moment, from conception, pregnancy, childbirth, childhood, adolescence. These are very these are very important periods that actually public health professionals should actually look at and ensure that people transition through these phases smoothly without exposures to factors that can actually contribute to disease. Okay, so that is the first point, that early life experiences have an impact in someone's life, because they can be exposed to factors that can cause illnesses in their course of life. And then we have the second point, which is the critical periods. Okay, from conception up to adulthood, there are specific durations, or there are specific periods where anything can happen and then it affects the next level. Those are the critical periods. So in the context of public health, exposure to adverse effects or even toxins in pregnancy and early childhood, this will have a long-term impact, and we don't want this to really happen. That is the principle, or that is the aspect of critical periods. And then the last one, the next one, which is the critical, cumulative effects. This one lists the fact that, you see, for every health risk that you face or that you get, these exposures or these risks will accumulate over time, and in the end, indeed, they will have an impact on your health and therefore health outcome. So, for example, if you start smoking in early childhood, and then you go on at some time T, you get lung cancer. It shouldn't be a surprise that you actually get lung cancer, because the cumulative exposures to smoke and other toxins in tobacco will actually determine whether you get lung cancer or not. Another aspect is what we call the social determinants of health. This basically emphasizes that, you see, the conditions of where we live, where we stay, the people around us influence our health. Okay, so where you take your child to school, where they work, where they are going to stay, when they are married and things like that, influence their health. And then we have the element of life transition, moving from one major life stage to another. Moving from adolescence to being an adult is very key. That period needs proper guidance and transition. Then you move to marriage, you move to parenthood, you need to retirement. Retirement is another huge problem. People who retire, how many years do they live after retirement? Or their life actually ends abruptly after retirement. That is life transition. And then resilience and adaptation, which are basically skills to be able to adapt and build resilience to respond to life challenges. Okay? Everyone has their own level of resilience and adaptation. And this is very important in avoiding or coping up with life issues. And then the interaction of biological and social factors is also very important. For example, interaction of genetics and the environmental factors shape the occurrence of certain life or health trajectories, or even disease outcomes. Okay, so what does the life course perspective in public health really imply? What does it educate us about? It tells us that, you see, from the point that a woman conceives, that point is very important, because it will influence the nature of the human being that they actually produce. So it is very important to plan for everyone within the life course, because they are facing different challenges. But of course, ultimately, their experiences, their exposures will determine their health outcomes, or will determine their lifespan or life expectancy. Okay, so if you have a mother who is HIV positive and is pregnant, if you don't make sure that the person is treated to prevent mother-to-child transmission, you're basically cutting or shortening the life of the unborn child. This is basically what the life course perspective teaches us. If the child is exposed to the HIV, and then it means therefore that their quality of life afterwards is going to be negatively influenced. That is phase number 2. Number 3, I mean. So